I meant to say this at the very beginning, but certainly, Proverbs 16:3, I believe, is commit your work to the Lord and your plans will be established. And so this is his foundation. I know for you, this is his clinic. It's not about you, it's not about me. And so through that, you committed it in your retirement, and you put everything on the line, and wow, he's blessing it, and his works and wonders are following. So to set this up before we move forward, I'd like for you to share a little bit about the healthcare system there, and I'll kind of segue into that. I'll kind of give a little bit of information at first, but I know for me, when I first got there in August of 2023, I was just, some of the equipment supplies were so old. They were from like back in the 90s when I first was in the hospital. From a safety standpoint, it was really disturbing to me kind of seeing that. And you remember, and I'm vaccinated against yellow fever, typhoid, and was taking malaria pills. And here, I don't have to worry about any of that here. And yet people there, 90% of them are not vaccinated, and they're dealing with it every day. So a lot of people come to the clinic, they're already dealing with multiple ailments, and they don't have many, so they don't come until they're really sick, which complicates everything as well. So set the stage for what the system's like there and what you're wanting to create to overcome that, if that makes sense.
Sure. Sure. So just like you rightly say, I was in a state of shock in the beginning, where having an experience in the United States for years and actually getting a new experience in Monrovia, Liberia, where when someone came with malaria, for example, a child, they would grab the child and take the child to the bathroom and waste cold water on them. And I'm like, why are you wasting cold water on the child? Is that going to heal the child right away? So it's called a shower bath when they come with malaria and their skin is burning. We have to waste water on them and give them a shower bath and help calm them down. Oh, that was shocking to me, because usually, in a hospital or the clinic in the United States, once you come, there are advanced machines and machinery to be able to accurately diagnose you. And once you are diagnosed, you are put in on a bed. And once you are put in a bed, the nurse come and start to administer medication and call in. So it was totally different from what I was saying. So instead of the stretcher and a medical doctor and a physician assistant, it was like bathroom and cold water. And I still could not understand how the water was going to help heal the child.
Right.
So so that was the first shock. Second shock was, honestly, I didn't have the experience within the industry in Liberia, so I was almost on a learning curve, meaning I had to ask questions and I had to give way to whoever knew what they were doing to kind of perform the task itself. So in the beginning, it was a shock, it was a learning curve. And at the same token, I got to see experience that I built up over time, where many lives were saved, whether it was an emergency injury where we had this patient come in and the entire face was torn. And for some reason, without using advanced equipment, they would grab like a needle, all right? Needle and thread, but it's called suture because the suture is designed differently than a real needle. But I'm calling it a needle and thread it's as a pin a picture.
It's not,
but it's really a suture. Yeah.
You're going to have as clean of a dressing. You're going to have a little bit.
Yes, dressing. Yes, dressing. And they would do it with their hands and kind of like they are sewing with their hands. And this patient will be in excruciating pain with less anesthesiologies. With overseas, you get some form of anesthesiology to kind of numb the pain. It's different now. And, saying that for the first time where the patient is in pain, but they are still trying to save the patient life by stopping the bleeding and stopping the wound. So in summary, it was a shock. It was a learning curve. and I had to give way to the experienced professionals to perform their work while I watch and learn along the way.